It is Breast Cancer Awareness Month. This week, the spotlight is reminding us all about early detection, prevention, support. Breast cancer apparently affects millions worldwide, and here in Nigeria, awareness is key. We guys know. Joining me today is Blessing from Diamed Centre. Good morning, Blessing.
Good morning.
Welcome to the show.
Thank you.
As always, I need to let people know that, Diamed Centre is one of those places that when you go to, you fall sick, you go there and you forget your sickness. It's like I see there's beauty all around. Is it that beauty or freshness or just something? Okay. You guys are having a ball at that hospital. You have a ball, don't you?
Obviously.
Welcome, Rad Blessing. Now, let's talk about breast cancer awareness.
Okay.
That's one of the, would I say, common cancers that we have.
Yes, in women.
Yeah, a lot of people just have fears. I've had a breast cancer scare. I've had a time where I was every time now, at least once a week, I check myself because I've had a scare. I've had a period where I was worried. I was like, am I about to die? What's about to happen? Thankfully, I got to the hospital. I was checked and, I had a surgery. I mean, moved on from that. And then I've been living my life la vida loca. Yes, I'm enjoying.
That's nice.
Yes. So now let's get straight into it.
Okay.
What is breast cancer? And why is the awareness so important? It seems like it is one of the cancers that people always have to talk about over and over. Would you say it's the most common one, and especially in Nigeria?
Well, actually, breast cancer is the most common type of cancer in women globally and even in Nigeria. So mostly the reason why we advocate properly for breast cancer awareness is because in 2020 in Nigeria, we had over 28,380 reported cases and over 14,000 deaths on that same year, you understand? And globally in 2022, we had 2.3 million reported cases and over 670,000 died of that same year. So breast cancer it needs more attention. It needs more care. We need support. And then we also do this awareness to actually honor those who have lived with this breast cancer, to honor them, and also to help early detection, because early detection of breast cancer actually saves lives. I tell young ladies that your hands can save your life, because when you do your monthly breast self-examination, that's the start of something huge. So if you can keep up with your monthly breast self-examination, it's going to be a stepping stone for something so great and wonderful.
Right. We always hear about early detection saves lives, and that's something that you're actually reiterating now. Now, practically, what does that even mean, and what should women always look out for? I mean, what are the early signs? Because a lot of people just feel, my breast is paining me, I have breast cancer. Like this day and age, you know how people run with, say, I have ADHD just because you're thinking different things. I have depression. So some people will just say, I have this pain. What should people actually look out for? And what do you mean by early detection?
Okay, when we say early detection, it's just like nothing just all of a sudden comes out. Yes, it always starts small. So the essence of early detection is actually to catch something when it's still very small. And whenever we catch it very small, it can save costs, it can save life. It can also reduce treatment options. Yes, so one of the tips of early detection is actually the monthly self-check. For women lower than 40 years, we actually advocate you to do your monthly self-breast examinations. When looking at the mirror, women will like to look at the mirror a lot. So when you're looking at the mirror, you can as well put that to good use. You can check your breast, put your hands on your breast, your parts of your hands, rub in circular motions. I don't want to go so deep.
I think you need to help us. Please, just let us paint a picture of how we can do a simple home breast examination at home.
Okay, so as a lady, when you get up in the morning, it's usually done, let's say 5 to 7 days after your period. At least then the breasts are no longer so, dense and full. So you can stand up, look at the mirror. You can first do visual assessments, look at your breast, check for changes in shape, any discharge, or any abnormal thing that you don't usually see before, that's the visual inspection. Then you can start with your left or your right. You can take one hand up, use the other hand, move, just go around your whole breast in circular motions, assessing for anything you're going to see, maybe a lump or any abnormal thing you're seeing. And if peradventure you discover or you see anything that is a worry, then you can as well go for a clinical self-exam where the doctor or the specialist particularly does it for you, because most times we don't get it right. Yeah, so you can as well go for your clinical exam, and if peradventure they check it and they actually find something, then they can pick it up from there. And that is why early detection is actually key, because when you detect this on time, we can actually solve the problem and get it fixed properly and on time.
Talking about detection, so first of all, let me talk about detection. That a funny story where when I had lumps in my breast, I went to the hospital and there was just one. It was on my left.
Okay.
So after the doctor said it, then it said, I have to come back about a week again for another examination, just to check. And then I went back and the doctor found another one on my right breast. And then he was like, there's a lump. I said, there's no lump. I was arguing with the doctor and he just stopped. I was much younger. He just stopped and he looked at me. He said, I don't want that would tell me my work. There is another one, so you have to have operations on both of them. I was like, okay, yes. And I did it. And yes, thankfully, it was all sorted out.
Okay.
Now, you also spoke about discharge. I've had situations where I remember a conversation in the past when somebody said, milk is always coming out of my breast. This is somebody who had never had a child or wasn't pregnant at that time. Is that normal? And is that a sign that someone should look out for breast cancer?
Exactly. Discharge from the breast is not normal, especially for maybe a young lady or someone who hasn't given birth before or who's not breastfeeding. Understand? So discharge from the breast is actually a cause to go see your doctor. Yes.
Okay. Any other thing aside from the lumps, discharge? What about pain?
Yes, sure.
Okay.
Pain is also a persistent pain, because we know normally during ovulation or your period, some people tend to feel breast tenderness.
Yeah.
Yes. So, but a persistent pain that even not during your period, you're feeling this pain, it's a cause for worry. You can as well see your doctor too.
Right.
About that.
So Blessing has told us about early detection. She's told us about self-checks. But, we need to know what causes this thing. So many people have said in the past that anything can cause cancer. But I believe that there are probably some certain lifestyle choices or things that can cause us risk or put us at risk to get breast cancer. So what are those ones?
Okay, like you said, there is no particular cause of breast cancer, but there are certain lifestyle behaviors that put us at risk to that, which are, the obvious ones, which we have the smoking, the alcohol, high intake of alcohol, obesity. We need to do something about our weight, both man and women. Yeah, so our weight factor is very important. We need to keep our weight in check, stay healthy, eat healthy. We've heard rumors of, well, I call it rumors, but we've heard talks about some certain foods causing cancer. The whole microwave story, the hot dog story.
Oh, I don't want to hear that.
Even noodles. I haven't heard of noodles. I love noodles too. So basically, we just have to reduce the way we eat processed foods. We should do more of natural foods, healthy meals, vegetables, and all that. And also, to help also manage this, we can also practice the early detection tips that I gave earlier, which includes the mammogram for 40 years and above women. So with these factors, I think we should be good to go.
Right. Now, say for instance, someone just found out that they have breast cancer, or they have lumps, or they're, certain things. What can they know about the treatments today? What are the first steps that this certain woman or man, a man can have breast cancer, right?
Yeah, sure, but it's rare though, but men do have breast cancers too.
Okay. Does he have to be a man who is built, with a plus size, or even slender men?
Well, that is what we call gynecomastia in men. So it necessarily doesn't have to be by size. Men can actually get breast cancer, but it's actually very, very rare. But it's not impossible.
All right. So now let me get back to the story, because I'm just thinking, this is not just for the women.
Women, yes.
Now, if somebody just finds out right now that they have breast cancer, What can you tell them about the treatment?
Well, breast cancer treatment first starts from the diagnosis. If the person has been properly diagnosed, then management starts. So if the cancer has been detected early, there are fewer treatment options. Like it can end up being just a lump removal. That's fine. Or depending on the stage, you can also advance to maybe adding chemotherapy after surgery.
Okay.
You understand? Yes. So there are also advanced stages too. If it's properly advanced, there will be more how will I put it?
The later you
Yeah,
find
the
out.
later you find out, the more the treatment options.
Oh, wow. Okay.
Exactly. So depending on what stage you are or how early it was caught, that was to determine the treatment options for
Okay.
you.
You know what's crazy? I'm one of those people who likes to do things late. I always wait to the extreme. My phone fell down, the phone screen broke. A lot of people were saying, "Go fix it." I said, "No, until the phone should get blind, until you just till one day the thing just messed me up and I was stuck." I've always thought that cancer is cancer. Whether it's small, whether it's big, whenever it is, you still have to get surgery. So are you saying that sometimes you could have this and not need surgery? Are there other options? Are there other ways that things can happen? Or it just depends on what is happening in your body?
Again?
Are you saying that sometimes you can have breast cancer and not require surgery? Or every single time once there's a detection there must be surgery? We've seen how different times different technologies have come. Some people will say, oh, there's no need to go to the hospital for them to cut you off. Oh, take this medication, or take these drugs, or take this drink, or you can do laser, or whatever it is. Are there new technologies or traditional methods that you would say you've seen to help with those with cancer?
Okay, personally, in as much as we're traditional people, I don't believe that traditional intervention can actually cure cancer. Yeah, so I always advise people to always be in good communication with their doctors.
Right.
Yeah, the doctors are going to put you through your whole treatment process. And once you've been diagnosed with cancer, there has to be a treatment.
Okay.
Yes, there must be a treatment for it.
Okay.
Like I said, depending on the stage or the level at which it is, most might just require surgery, to take it out.
Okay.
Yeah, while some might require additional treatments.
All right. All right. Thank you so much. You have given me so much knowledge for today. But before I let you go, I want you to confirm or deny some of these myths that happen to do with breast cancer. So they say breast cancer only affects women. You already answered that, but you can do that again.
Oh no, breast cancer affects both men and women, but it's more in women than in men.
If you don't have a family history, you're safe.
No, you're not safe either. But we all know that when there's a family history of cancer, there's higher chances of you getting it. But when you don't have a family history, you're not also safe. So you still need to go for your yearly checkups, you do your monthly self-exams, because honestly, nobody is safe.
Nobody's safe. You can't touch anybody.
Yes.
Now, breast cancer is always painful.
I won't concur or deny that, because people feel things differently. People have different pain thresholds.
Right.
Yeah, like someone like me, whenever they're about to inject me, I cry a lot, even at this age. So, but some people it's nothing to them. So I can concur. Some people, it might be painful, it might be very traumatizing and all that, but it varies differently in people. And that still leads us to the theme of breast cancer awareness this month. And of this year, 2025, the theme is every story is unique and every journey matters.
Right. Very well said. A lump in the breast always means cancer.
Well, we have benign cancer and malignant cancer. Yes, so you might have a lump, but it's necessarily not going to be cancerous. So if a lump is benign, it can just be easily taken out. When we say benign, we mean it's not spreading, it's localized in a spot. Yeah, so it can just be taken out.
Okay, so I want to ask you something personal. So when I had that lump, if I didn't take it out, what could have happened? Would he have? Because when I took it out, they said it was benign, and I don't know if I'd left it there, it would have turned into something else. Or once it's benign, it's benign. They change.
Oh no, the truth is most cancer starts from being benign and go to cancerous.
Okay.
Understand? Yes. So most times, not all the time, when a cancer stays, if it's benign, once it stays for so long, it can get malignant.
Okay.
But nobody knows at what point or whether it will actually do so.
Okay.
Yeah, so most people don't like to just go in. Most doctors will say, just leave it. It's benign, you understand? While some will say, some people naturally are not just comfortable knowing that they have a lump in their breast, because they always feel like it might likely get cancerous, so they just like to take it out.
Okay.
So if you have a lump in your breast and it's affecting you maybe mentally, emotionally, or you don't just so, you can opt for removal.
Okay.
But with everything we're doing is with the guidance of your doctor.
Okay, but when I had that, they didn't say keep it. They said you have to take it out.
Yes, sure. If like I said, if it's benign and the doctor assesses you and checks it out, he will tell you, oh, you need to take it out, or you need to,
Very well said.
follow up.
Women wearing underwire bras causes breast cancer. Go stay.
That might be a myth.
Okay.
There's not really been confirmed.
Okay.
It's not really been confirmed.
All right. If you eat healthy and exercise, you can't get it. Does lifestyle completely protect you, or are there still risks?
Well, life choices can help prevent, or rather can help, keep you healthier. But honestly, like I said, cancer is cancer. It can hit you even with your lifestyle, but it is better to still maintain a very healthy lifestyle.
Okay. Now, they say once you have breast cancer, it means losing your breast. Is mastectomy the only treatment option?
No, not at all.
Okay.
Did you say breast cancer or breast lump?
Breast cancer means losing your breast.
No, not at all. That is where we still factor in early detection.
Okay, fantastic. Mammograms are dangerous because of radiation. Is it risky to get checked? Because some people say the more you put machines on you, the worse your life becomes.
No, not at all. Mammograms are actually safe when done properly.
Okay.
Yes, so mammograms are done for women aged 40 years and above.
Okay.
Yeah, because you obviously know that mammograms have little radiation involved. So we prescribe mammograms for women 40 years and above and not below, and ultrasound for 40 years below women.
Okay, fabulous. And lastly, once you survive breast cancer, it can never come back. Is that true or false?
That's not true.
Okay.
Breast cancer can actually come back because it's cancer.
Okay. Thank you so much. Do you have any final thoughts? Anything else you want to put out there?
Yes, there is something I want to say. I want to say that to women and even men, health is wealth. And I want to also, encourage men to support women in their lives. Give them support. Let's remove stigma and replace fear with knowledge and action. So men, try to encourage your women to get their screenings and their yearly checkups done, and stay healthy.
Stay healthy. Thank you so much, Blessing. In the meantime, if anyone wanted to come through to get through to you, how can they find you?
Okay, you can find me at Diamed Centre, TF Kuboye Street, Lekki Phase 1.
Very well, thank you. This is Base 101.1 FM. My name is Chacha. Good morning.
In emergencies, every second counts. That's why Diamed Centre is here for you 24/7.